I was talking about both from my clinical perspective, because I work mainly with head and neck cancer patients, and they are often in need of early palliative care, like they need symptom management even during their curative oncological treatment. And we refer them to our teams, palliative care teams outside the hospital. And my talk was actually about the integration between the oncological team and the palliative care team, and that sometimes clinically I see that the patients gets sort of caught in the middle. We don't speak to each other properly. And so I gave them first data from some studies regarding palliative care, where you actually see that all the interventions vary, and it's sort of never defined how the collaboration was or how the teams were cooperating. And then I was giving them some clinical examples, some cases and quotes from the patients, and because the patients actually do talk about this a lot, and they just assume many times that we have contact more than we have. And also patients often say they don't want to be responsible for being the messenger between two teams. And I also showed them data from a clinical evaluation we did on emergency admissions in the group of patients that had both oncology treatment and palliative care. And then I also a little bit were discussing this, that perhaps early palliative care is not beneficial if we're not integrated, the two teams. And that I think we need to do more research and need to investigate this more, how we should collaborate, how the organization should be, what is early palliative care, basically.